Case selection is very, very important because you do not want to sort of not feel like an expert when doing the case.
Using my case selection criteria, which I've spent years developing, I found the components that go into a simple implant case. And I found when a case presents with additional complicating factors, it's best handled by somebody who may place implants every day. The challenging part for the general dentist is to figure out which cases are too hard to do or which cases they could tackle in their office.
The protocol spells it all out for you. And you know, it goes through how much bone you need, what height you need, what implant to use in that area, if the site is edentulous or if there's an existing tooth that needs to be extracted.
It is a 10-point checklist where I am confident if you can check off every point on this list, it will be a basic, straightforward case that you can handle well in your general practice.
One of the problems in the early years is that the educational pieces tended to start up in very complicated, hard cases, which left somebody who was just starting out really lost almost. So over the past 10 years, I've been kind of developing an implant training program where you start with easy cases, having building blocks to build up to more advanced cases.
Part of the basic training for IMC, Dr. Goodman's vision, has been to start slow, start with the basics, and learn how to select the appropriate cases where the likelihood of complications would be minimal, the quote-unquote slam dunk cases. Then building upon that, as dentists become more comfortable with those routine cases, then IMC offers courses for more moderate or advanced complex cases.
What Dr. Goodman does is he really sort of lets you know what you should do and what you should not be doing. And then it's sort of up to your own ego as to what you tackle and what you don't tackle. The cases that he's recommended that I do have been very successful.
So following this protocol, I'm able to assess cases with the general dentist that they can handle, basic, straightforward cases, but also let them know when a challenge will occur and it might be best handled by someone who's a specialist who has the tools to handle these complications. I'll also be happy to review these cases with you so we can figure out together if this is going to be a good case handled in a general dentist's office or if the surgical aspect should be handled by a specialist.
From my point of view, either situation is wonderful, whether they're placing just the simplest of cases or some of the more moderate or complex cases. There's still going to be interaction and a synergistic treatment planning approach with the specialist.
After a reasonable training period of maybe 3 months, I do believe that a general dentist can start placing implants provided they do so in a responsible fashion and they're not tackling cases where the consequences are going to be severe.
When I learned to do implants, there was nobody to teach you. You just kind of did it and you screwed up sometimes and sometimes you did well. I would like to avoid that for most other practitioners. They shouldn't learn by trial and error. There should be at least a mentoring process or some resource for people to go to.
The beauty of IMC is it's sort of through the program, they sort of let you know where you're at and what you should be doing and what you shouldn't be doing. But believe me, the protocol is there, and if it's followed, you could successfully integrate dental implants into your office very, very easily.